Sodium and potassium excretions, mortality, and cardiovascular events. Most of the global population consumes between 3 and 6 grams of sodium per day. Guidelines on cardiovascular disease prevention recommend a maximum sodium intake of 1.5 to 2.4 grams per day. By achieving this target, we require a substantial change in diet for most people.
What is sodium? Sodium is a naturally occurring element that is found in most foods. The most common form of sodium is in table salt. Your body uses sodium to control your blood pressure and blood volume. Your body also needs sodium to help your muscles and nerves work properly. However, when a person consumes too much sodium,
Although clinical trials have shown a reduction in blood pressure with a reduced sodium intake, to our knowledge, no large randomized trial has been conducted to document reductions in the risk of cardiovascular disease with low sodium intake. Prospective cohort studies have shown inconsistent associations between the sodium intake and rates of cardiovascular events and death. Several studies have shown an increased risk of cardiovascular disease or death among people consuming less than 3 grams of sodium per day, as compared with average intake, but many of these studies include people at high cardiovascular risk, who were not representative of general population. The association between sodium intake and cardiovascular disease is complex and may be modified by the other dietary factors such as potassium intake, which has also been associated with the cardiovascular risk.
Hi, I'm Raymond Francis, and today I want to talk about something we all have in our kitchen, something we think of as benign, and yet it can kill you. I want to talk about table salt. Excess salt intake is a deadly poison to the body. In each of my books, Never Be Sick Again, Never Be Fat Again, and Never Fear Cancer Again, I warned about the dangers of consuming the excessive amount of salt that most Americans are getting in their
High blood pressure, or hypertension, is a common condition in which the force of blood on the walls of your arteries is often too high. Arteries are the blood vessels that carry blood away from your heart to supply your tissues with oxygen and nutrients. In your heart, 2 chambers, called ventricles, contract with each heartbeat to push blood to your lungs and through your arteries to your body. As blood flows through them, 3 main factors